High Definition News updated for Wednesday, October 15th, 2014. I'm Jeff Kaufman.
What we are dealing with is a disease that's unfamiliar in the U.S. And caring for Ebola can be done safely, but it's hard. And we want to make sure that the protocols that we have and the support we have for healthcare workers are there on the ground so we can assist.
Centers for Disease Control Director Dr. Thomas Frieden announcing that an instant response team has been organized to try to prevent any more healthcare workers from being infected with Ebola. This as we learn that the second Dallas nurse to be infected violated CDC guidelines and boarded an airline flight just 24 hours before she was diagnosed with Ebola. The focus in the Ebola story has shifted today from the status of individual patients to the protocols that are designed to keep healthcare workers safe. The questions, are those protocols strict enough, and are they being followed? The answer at Texas Health Presbyterian Hospital seems to be shaping up as no. It was there that 29-year-old nurse Amber Vinson was part of the team treating Thomas Duncan, who died last week at that hospital after contracting Ebola in Liberia. Just like her coworker Kim Pham, who was diagnosed with Ebola on Monday, Amber Vinson had contact with Duncan on September 28th and 29th. Those dates are important because that was the period when Duncan was very sick but had not yet been diagnosed with Ebola. He was putting out a lot of bodily fluids and going through a lot of hospital gowns and bedding and other materials that had to be collected and disposed of. The hospital team was wearing those specially designed protective suits on those days, but the next day, September 30th, when Duncan was confirmed to have Ebola, a CDC team arrived at the hospital, and Frieden says they were shocked by what they saw.
Some healthcare workers were putting on 3 or 4 layers of protective equipment in the belief that this would be more protective, but other things were done, such as taping parts of the protective gear, again, in the belief that this would be more protective. But in fact, by putting on more layers of gloves or other protective clothing, it becomes much harder to put them on, it becomes much harder to take them off, and the risk of contamination during the process of taking these gloves off gets much higher.
Frieden says they don't yet know if that's how either Vincent or Pham was infected, but CDC has added a layer of management to try to ensure that it does not happen again. There is now a CDC-appointed site manager in Dallas coordinating the training of healthcare workers in those safety protocols. And Frieden promises that if someone shows up at a hospital in some other city with symptoms of Ebola,
starting today, is establishing a CDC Ebola response team. For any hospital, anywhere in the country that has a confirmed case of Ebola, we will put a team on the ground within hours with some of the world's leading experts in how to take care of and protect healthcare workers from Ebola infection. And, you know, I've thought often about it. I wish we had put a team like this on the ground the day the first patient was diagnosed. That might have prevented this infection.
Amber Vinson came down with a fever yesterday. She was tested, and by midnight she was in isolation. This afternoon, she'll be transferred to Emory University Medical Center in Atlanta, where the 2 American missionaries who contracted Ebola in Liberia were treated successfully. Neither federal nor hospital authorities have said why Vinson is being moved to Atlanta and Pham is not. Though they do list Vinson's condition as ill but stable, Kim Pham's condition is listed as good. Teams in Dallas have already notified Vinson's neighbors, and they have sanitized her apartment. A Frontier Airlines jet has also been thoroughly cleaned twice because Vinson flew on it only 24 hours before she showed symptoms of Ebola. She violated CDC guidelines when she boarded Frontier Airlines Flight 1142 from Dallas to Cleveland last Friday. Remember, she was one of 78 people who had come in contact with Thomas Duncan and who were being monitored for signs of Ebola. The rules say they can travel by car or charter flight, but not on a commercial airline. What's not clear is whether Vinson knew that. She hopped the flight to Cleveland to visit her family and plan her wedding. She flew back to Dallas on Monday aboard Frontier Airlines Flight 1143. The flight crew remembers her, says she did not have any symptoms, which would mean she was not contagious. She came down with the fever the next day. But just in case, the CDC wants all 132 passengers and crew aboard Frontier 1143 on Monday to check in, to call the CDC at 1-800-CDC-INFO, 1-800-232-4636. We'll post that number at highdefinitionnews.com. President Obama canceled a trip of his own today. He was due in New Jersey and Connecticut for Democratic Party fundraisers. But with the mess in Dallas and a new poll showing that only a third of Americans believe the government is doing everything possible to prevent an Ebola outbreak, the president ordered Air Force One back to the hangar and convened a meeting of his cabinet and health-related agency chiefs at the White House to talk about Ebola. White House spokesman Josh Earnest told the Daily Press briefing a bit ago that a ban on travelers from West Africa entering the U.S. is not on the table, but screenings of passengers arriving from Liberia, Guinea, and Sierra Leone are getting into high gear at 5 airports, mostly in the east. It's worth remembering that the group Doctors Without Borders has treated more than 2,000 cases of Ebola in West Africa, and 2 of its personnel have contracted the disease. The hospital in Dallas has treated 1 Ebola patient, and 2 of its personnel have contracted the disease. The National Nurses Union says it's been trying for weeks to call attention to what it says is an American healthcare industry totally unprepared to deal with Ebola. The union's Gene Ross on CNN this morning.
To the public, to the CDC, whatever, they say, we are all prepared, don't worry. And the nurses are saying, no, we are not. We ask for the plan, they either don't have one, they direct us to a website and say, here are the CDC guidelines. We ask for direct hands-on training and drilling, practicing. And either we don't have the staff, we don't have the equipment, etc.
We hear and understand what the nurses, their concerns.
Health and Human Services Secretary Sylvia Matthews-Burrows had a shout-out and a reminder for those nurses and others on the front lines.
Whether it's those healthcare workers that are in the emergency room or those that are doing intake, what is so important at that first line is for everyone to know at the point at which they see a fever, ask a travel history.
UCLA Medical Center, for one, is redoubling its personnel training in Ebola procedures, holding drills all this week with a massive drill on Friday. They are still looking for the man in a gas mask who got on an MTA bus in Lincoln Heights Monday, said he had Ebola, and then got off the bus and disappeared with a female companion. Metro police are going through the bus's surveillance camera recordings to try to identify the two. They're pretty sure it was a hoax, no contamination on the bus. And yesterday it happened again, this time in downtown L.A. 3 people got on a bus, chanted that they had Ebola, then ditched in 3 different directions. MTA says that one looks like a hoax too. A hoax, but not a joke. If they catch any of these jokers, they could be charged with making a terroristic threat. That is a felony, with a possible sentence of $10,000 and or 5 years in the Gray Bar Hotel. Remember when the biggest health crisis we faced was the flu? The good old days. Actually, the good old days are right now. It's flu season. Time flies when you're distracted by a people-eating virus. Health officials in Southern California are saying today that Ebola is an excellent reason for you to get a flu shot. The flu shot won't protect you from Ebola, of course, but it will protect you from the flu. And since the earliest symptoms of the flu and the earliest symptoms of Ebola are pretty much identical, healthcare workers say the more people who don't get the flu because they got a flu shot, the fewer people will walk into doctors' offices and emergency rooms this winter scared out of their wits that they might have Ebola, when all they have is the flu. That's good for the system. More resources to battle people who do get sick with either the flu or Ebola. And it's good for you, because you don't need to be told the flu sucks. Lots of free and low-cost flu shots around Long Beach and Southern California right now. Go take one for the team. Here's some catch-up for your Wednesday lunch. All this happened since you stopped paying attention yesterday. L.A. Mayor Eric Garcetti is gunning for that symbol of the sunny Southern California lifestyle, the front lawn.
The ongoing drought has created a water crisis, second to none. We need bold action.
Garcetti signed an executive order that mandates a 20% reduction in water use by the city government over 5 years. City lawns will be watered only 2 days a week. The plan also calls on LA residents to water their lawns only 2 days a week and to cover swimming pools to prevent evaporation. Those are voluntary guidelines, but Garcetti warns they could become mandatory. His goal is to cut in half the amount of water LA imports. Water, he says, is costly and could become unavailable after an earthquake.
Reducing water is not just good for our environment, it lowers our bills. Right now we're paying $1,032 per acre foot for imported water, an extraordinary price. Conserving that same amount of water through DWP rebate programs costs up to 30% less.
Here's the good news. The city is raising the ransom it'll pay for your lawn. Rip out the turf and you can pocket $375 per square foot. That's even more generous than Long Beach's $350 a square foot. Hey, guess who's coming back to TV? Jay Leno. Not with a talk show and not on NBC. Well, not on Big Boy NBC. Jay Leno's Garage will premiere next year on CNBC. It's based on the web series that Leno has been doing for a while, which has been pretty successful. The show will be built around his mammoth collection of vintage cars, which he stores in a warehouse near Burbank Airport. Our friend Jane Wells of CNBC tried yesterday to get Leno to come clean on how much that fleet is worth.
You know, it's a lot of money. Can I ask how much money this is all worth?
Oh, I have no idea, but I think it's safe to say whatever I paid for it has doubled or tripled in value, certainly. Automobiles seem to be a pretty good investment. I don't know if it's quite as good as artwork, but it's right up there. The McLaren F1, which was an $800,000 car in 1998, is now worth $11-12 million. So you don't really lose money with these.
Now, when he says you, he doesn't actually mean you or this reporter. The high-definition Newsmobile, a sporty ginger ale-colored Nissan Maxima with 100,000 units of journalistic experience and a center console that eagerly pops open whenever the brakes are applied, probably not increasing in value. Just saying. Now you know what we know. I'm Jeff Kaufman, High Definition News.